Thank you for having me here today. I wanted to talk about avian flu. It's been in the news, as you know. And to be honest, I had a little trouble putting this together because I'm not sure about people's background about influenza and avian flu. So stop me if I'm getting too much in the weeds or if I'm explaining things you already know. So, just a second. There we go. We're going to talk about flu in general and how it changes, and that's why we're concerned with avian flu. And then avian influenza, what's happening now, and what's the potential for this developing into a pandemic. So it's important to know a little bit about the virus that causes influenza and therefore avian influenza. There are three types. We're really only concerned with A. A is has what's called a segmented genome. It's got 8 different segments you can see in that little graphic. And remember that because that's going to be important coming up. Also, on the surface of the virus particle is a hemagglutinin, sometimes abbreviated HA, sometimes just H as in H5, and a neuraminidase, again, sometimes NA, sometimes N as in N1 on the outside of the virus particle. And that's a major parts of the virus that we make immunity to. The other important thing to know about influenza A is that it can infect a number of different animals, whereas B and C only infect humans. So there's a lot of variation in these hemagglutinins and neuraminases. There are 18 subtypes. So it goes 1 through 18. Again, think H5. And some of them are human influenza viruses, but there are others that can infect humans, even though humans aren't the primary species that gets infected. For the neuraminidase, there are 11 types, 1 through 11. And again, there are neuraminases 1 and 2 are human parts of human viruses that can infect human, and 7 can also infect human. So what are we talking about with avian influenza? These viruses can infect influenza A, can infect a number of different species. And usually it stays within that species. But, birds infect other birds. But sometimes we have what's called spillover to another species. And you can see from this graphic that birds can infect a wide variety of different animals. And sometimes birds can infect humans. Pigs are especially important because the pigs are capable of being infected with bird viruses and with human viruses. Now, remember I told you about those 8 segments. That is going to become important again. When we talk about changes to the virus, there's 2 major ways the virus can change. One is called antigenic drift, and an antigen is just the part of the virus that you make antibodies to. These are minor changes, think drift, and they're changes in the hemagglutinin and neuraminidase. So you can get a mutation like with any virus, as we saw with COVID, in those RNA segments that are coding for the hemagglutinin or neuraminidase. If you have right now in the human population, we're seeing H1N1 and H3N2. It stays, you can have these minor changes, but the numbers stay the same. So that's called the serotype. And this happens every year. This is one of the reasons why you need to get a flu shot every fall, because the virus has changed enough that your immune system needs to see something a little different to protect you. What we're really concerned about, though, is antigenic shift. And these are major changes in the hemagglutinin and or neuraminidase. And what happens? Remember those 8 segments. In fact, I'm going to go to the next slide. So what happens with reassortment is you get some segments, and this often happens in pigs because they can be infected with bird viruses and with human viruses. You get some of those segments from the bird, you get some of the segments from human, and now if you see on the right-hand slide, in the pig, you've got a completely new virus, hasn't been seen before because of this reassortment. When this happens, this is when we get pandemics, influenza pandemics. And so this is what, ever since I was in graduate school many decades ago, we have been worrying about. And in fact, COVID was rather a surprise because we always thought the next big pandemic, we had one in 2008, H1N1. It luckily didn't turn out to be so bad, but it could. And this is always our concern. All right, so I just wanted to also let we talk about flu like, oh, I had the stomach flu. Well, influenza, it can cause some GI illnesses. That's not the major symptoms that you get. And if you truly have influenza, you are pretty sick. We see on an average year from seasonal influenza, about 50,000 people die from it, mostly young children and older adults. But in bad years, we can see much, much higher numbers. One of the hallmarks of influenza is sudden onset. I had influenza once when I was in graduate school studying influenza. And it's like you're feeling okay 1 hour, and the next hour you're pretty sick. That doesn't typically happen with a cold. One day you're not feeling quite up to snuff, the next day maybe a little bit worse. With a cold, you usually don't have a high fever. Flu can cause a high fever. The weakness and fatigue can last for weeks with flu. Doesn't usually happen with a cold. And so, and the symptoms that you have with the influenza are more typically lower respiratory, so your lungs, bad coughing. Whereas with a cold, it may just be in your nose, for example. So it's important to remember that influenza is a serious illness. I'm not sure anybody ever dies from a cold. Maybe somebody does, but you get over it. Influenza, it can be quite serious. All right, so let's talk about avian influenza. This is hemagglutinin 5. Remember, that's something that can infect humans. Excuse me. And neuraminidase 1. So we have seen a lot of different avian influenzas, but I'm going to talk about H5N1 because that's what's in the news. So this first was detected in waterfowl, and that's typically where we see it, in ducks particularly, poultry as well. But this one was first detected in China in 1996, and for several years it just, we saw it occasionally. It wasn't a big deal. However, in 2003, it reemerged, and we saw big poultry outbreaks in China and other Asian countries. And then in 2005, we saw wild birds. Now, wild birds can get avian influenza, but not as typically as waterfowl. And this, probably through migration, this virus was spread to poultry in Africa and the Middle East and Europe. All right, now we're starting to see it across the world. Now, in 2005 as well, we saw a new clade of H5N1. So let me explain some of these terms. A clade is just a minor change, but enough to cause, so it's like antigenic drift. Minor changes, but it's still H5N1. What was important about this new clade is that now it was classified as highly pathogenic avian influenza. That's the HPAI. And so before it had been classified as low pathogenic, LPAI. Now it's really causing a lot of deaths in birds and poultry. And it's also important to remember that the highly pathogenic designation refers to how it affects birds. It doesn't say anything about what happens if it crosses species. Now we've got this clade that is highly pathogenic, and it is adapted to wild birds. Ducks don't usually travel so far, right? They're not flying around the world for migration. Wild birds are. We now see it in Asia, this particular clade in Asia, Africa, Europe, and the Middle East. And in 2021, we saw it spread to Canada and the United States in the birds. Now, in 2022, we started to see in the United States commercial and backyard poultry outbreaks. What happens when, besides the birds dying, if they don't die, they are what's called culled, which means basically they are sacrificed so that the outbreak doesn't spread. And if you remember, egg prices were very high at that time. And the reason was because so many poultry, so much poultry had to be culled because of this highly pathogenic avian influenza. We saw across the world rare human infections. This happens. It is usually from people who are in close contact with birds. We're still talking about birds here. And very rarely, if at all, sometimes it's hard to tell, human to human transmission. And we also saw a few infections in other mammals. And we also saw the first case of avian flu in the United States from an avian source. This was in Colorado. So from 2000, just to summarize what the history of H5N1, from 2003 to 23, there were a little under 900 bird to human infections. What's important here is that the case fatality rate is very high. More than half of the people who got this virus died. Luckily, there was, if at all, as I said, sometimes it's hard to tell where transmission's occurring. Human to human transmission was not occurring. It's a tragedy for those 889 people, but luckily we did not see a pandemic because of this. And then since 2022, there have been 27 cases, again, with about 50% of them dying. So this outbreak of H5N1 in avian species is the largest that we've ever seen. Also, what's unusual about it is we have seen over 48 mammalian species that have been infected. And this picture in the upper right-hand corner is of seals. We've seen massive die-outs of seals. We've never seen avian flu spread to all these mammals. Sporadically it's happened, but I just read a paper yesterday, alpacas have been infected, cats, as was mentioned, have been infected, lots and lots, bears, lots and lots of different species of mammalian species have been infected with this avian flu. All right, now let's talk about avian flu in cattle. So in 2024, in March of this year, we detected H5N1 in dairy cattle, never been detected before. It is probably the case that it had been spreading for at least 5 months, but the first identification was in March, and the next month we had a human who got infected from a cow. Remember, in 2022, we had an infection in Colorado, but that was from a bird or chicken. This was from a cow. The next month, we had our second case in Michigan of human transmission from a cow. Both of these cases, interestingly, did not have the respiratory symptoms we associate with influenza, but just conjunctivitis. And they both luckily made complete recovery. The breaking news from today is that a third case has been identified in Michigan, and this case has respiratory symptoms. The concern is that there are undiagnosed infections going on as well, because we're not testing people. And we have seen some increases in the wastewater of influenza A. Now, actually, I'm going to save that because I have a slide on it. So what's happening right now in the United States? 48 states have had big poultry outbreaks. That is not unusual. We have seen that before. What is unusual is that 9 states have had dairy cattle outbreaks. The consensus is that the outbreak started in Texas, and then cattle are frequently shipped to other states. For example, when dairy cattle are going to calve, that they send them to special farms where they specialize in calving. So with the transfer of cattle, these states also had outbreaks. We have detected H5N1 in milk from dairy cattle. And just recently, it has been detected in dairy cattle meat. This is different from beef cattle that are not dairy cows. We have also detected in Texas H5N1, this avian flu that we're talking about, in wastewater. In other parts of the country, we have seen influenza A in the wastewater higher than expected. We're not in flu season right now, but we have seen higher levels than we would expect. However, unlike what we do as part of the TEPHI project, where we can test whether it's H5N1, all they are testing for is influenza A, and we don't know whether it's H5N1 or not. We also know that there have been dairy workers who had conjunctivitis, sought treatment at the same time that the cows were infected, but before we understood that humans could be infected and that this virus could cause conjunctivitis. We haven't seen that before. So, we can't test it. That's in the past, but it does seem plausible that maybe they had H5N1 infection as well. All right, so I've told you as of today, we have 3 cases. That's not so many. Why are we concerned? Well, for a pandemic to occur, we have to have 3 things. A new virus to which no humans are immune emerges. Check. H5N1. Nobody has had that except, maybe a handful of people, but certainly not widespread. It can cause serious human illness in humans. Well, we're waiting to see on this one and how this new case today with respiratory symptoms does. What we don't have so far is that the virus spreads easily from person to person. So that is what everybody is very concerned about, because if the virus adapts, and the virus, it's an RNA virus, just like COVID virus, it can change easily. And the more animals, the more humans that are infected, every time that virus makes more of itself, there's a chance a mistake is made in the coding, and you get a new virus that could spread easier from human to human. So this is why public health is watching the situation very carefully. This is a quote from the World Organization for Animal Health. Once considered primarily a threat to poultry, HPAI has ushered in a new normal where it's moving from wild birds to animals, and we've never seen anything like this before. And as I mentioned, the die-off in some of these mammal populations has been pretty extreme. So what's public health doing? Well, we are conducting surveillance activities on these farms. The US government has stepped in. So if you have poultry that are infected and you need to cull your flocks, the government will reimburse you for the cost. Well, or the money you're not getting from selling eggs or chicken meat or whatever it is. That was not the case with cows. That has changed to encourage farmers to report sick cows. The CDC and state health departments are monitoring workers because right now they're the ones most likely to become infected with this H5N1 avian flu. So they are monitoring them, the workers who have been in contact with either animals that are infected or you think might be infected, and testing them if they develop symptoms. There's recommendations to avoid unprotected contact with sick or dead animals if you think they have H5N1. Well, I'm not sure how looking at a cow whether it has H5N1. Also, just as an aside, apparently cow cuddling is a thing, and people will snuggle up to cows. And so it is recommended that you not do that anymore, in case you were thinking about it. CDC, state health departments are distributing PPE for dairy workers, but again, there has been some resistance there about using this PPE. And for the public at large, there are recommendations to avoid raw and undercooked dairy products, such as raw milk. Pasteurization kills the virus. So you are safe buying your milk at HEB, that's fine. If you have been consuming raw milk, unpasteurized milk, there are a lot of reasons that is not a good idea. That raw milk can carry quite a few different pathogens besides this H5N1. Same thing for raw cheese. If you have buy cheese that's made with pasteurized milk, that's fine. Raw cheese, there haven't actually been studies on it yet, but probably a good idea to avoid it. And then there have just recently been some studies looking at cooking beef. And the cooking, as long as you cook it to medium or well done, that does kill the virus. So what happens if this thing explodes and we do get sustained human-to-human transmission? Well, we don't have a vaccine right now to protect against it, although we do know that antivirals, Tamiflu, for example, should protect you, but that's after you get sick. There are candidate virus vaccines that the CDC has sort of banked that are thought to be protective. But just, for H5N1, since it first appeared, there have been over 50 candidate virus vaccines because the virus keeps changing. So and I'm going to say theory is that that one of these candidate virus vaccines, that is a vaccine that we think will match what will be circulating in the population. Of course, that's a guess. That it could be produced quickly and would be protective. Now, the quickly is in doubt because right now the vaccine, not all of, there's different types of flu vaccines out there, but the major quantity of vaccine are produced in eggs. There's two problems there. One, it takes a while to grow up the virus in the eggs, and then you make vaccine out of it. Secondly, poultry is being affected by this, and that's where your chickens are being, chickens are being infected. That is poultry. Sorry, I'm blinking here. Anyway, if they are getting infected and dying off or being culled, we won't have eggs. There are some RNA vaccines that are being looked at, probably could be produced faster, but this is, there's some disagreement about how quickly a vaccine could be identified. And then I think the big question is, will people take it? We haven't been so successful with COVID, have we? If you look at flu vaccine, the uptake, just seasonal flu, the uptake isn't great, even among healthcare professionals. So even if we have a preventative vaccine, would people take it? It's also important to recognize that if you have had your flu vaccine last fall, that will not give you protection. And there's still a good reason to get vaccinated with the seasonal flu vaccine besides protecting you from seasonal flu, because if you were unlucky enough to get seasonal flu and avian flu at the same time, that's reassortment could occur. And so preventing that would be a good idea. So what are our lessons from past pandemics? Well, we've been watching avian flu, different ones. There's just a child who died in China from I think it was an H7N5. I didn't write it down. Anyway, and there's all sorts of different types of avian flu. And they occur unpredictably. And whereas we think of winter as an influenza season, that's not always the case. In fact, my 5-year-old grandson in Austin was just diagnosed with flu A. It's interesting. Of course, they don't test for H5N1, and he hasn't been around cows, but you wonder. And the pediatrician said this wasn't the first case she had seen recently. We also know from past pandemics that even though we, unlike with COVID, where we had to develop a totally new vaccine, we know how to produce influenza vaccine. It just isn't going to happen real quickly. And so when we identify, if we identify a new pandemic influenza virus, it's going to be at least 1 to 6 months before we have limited supply of vaccine, longer till everybody can get vaccinated. And then, as I mentioned, will people take it? And so I don't want to scare you. We have seen outbreaks of avian flu before. We've seen human infections. We have been lucky that we haven't had a pandemic with avian flu. This one is a little bit different because of all the mammals that are infected. And there is the possibility that this virus may adapt to humans, because it has adapted to other mammals, is a little concerning. But right now, the risk is still thought to be low. But again, public health is keeping their eyes on it. So that's a whirlwind view of influenza and avian influenza in cows. Are there questions?
It was a great presentation. And it's not a question just regarding avian flu, also regarding any other pandemic that might happen. Why are we just concerned about the virus that is in the US? Couldn't the shift happen anywhere else in the world?
Yeah, and in fact, if you think back, let's just talk about flu, but or COVID. So in 1957 we had Asian flu. In 1968 we had Hong Kong flu. Now we don't call flu that anymore. We don't give geographic names. But the reason we see a lot of new reassorted viruses occurring in Asian countries. And the reason is that people live in general, this is in general, but in closer contact with poultry than we do in the United States. And culturally, people want to have fresh poultry. Me, I prefer to get my chicken shrink wrapped from HEB. I don't really know where it came from. But that's a cultural difference. And so because there's more interaction with humans and poultry, that's why we often see it in other countries. I didn't talk about a world pandemic treaty that's being negotiated right now. And again, if you remember during COVID, when the virus did come out, the rich countries like the United States had more than their share of the vaccine. Other countries, low and middle income countries, had more difficulty getting the vaccine. And that's one of the hangups in this pandemic treaty. But you're absolutely right. We're talking about it in the United States because that's where we are. New viruses can arise any place. That answer your question?
I guess the reason I was asking this is because I saw in the news today that there was the CDC was called into one of the airports because somebody had traveled with meat and there were maggots in it, and they were scared about that having some Ebola virus or anything like that. So again, because the world is such a small place at this point with travel happening all the time. So I was just wondering, why are we just worried about it transferring from cows in Michigan or in the states where cattle is being grazed, and why not have some sort of a protocol to test folks who are coming from other countries that might have strange symptoms relating to a flu.
Well, yeah, and I mean, you're absolutely right. You know, it used to take, I don't know, a year to go around the world, and now you can do it in 12 hours. And certainly we are concerned in the United States about, new viruses coming in. From a practical standpoint, because we haven't seen sustained transmission of H5N1, testing people just doesn't make it not very cost effective. If things change, that might change. But again, think back about COVID. By the time we started limiting flights from China, which had already had an outbreak, it was too late. And anytime you have something that causes asymptomatic infections where you don't even know whether someone's sick, you're just not going to be able to control spread of the virus.
That's true. That's true. Thank you so much.
Rosalia.
Yeah, so, a lot in the news has been around not consuming, a raw milk, and that pasteurization is taking care of anything that might come through in the milk. But going to like chickens, is there any scenario where a sick chicken could make it, or chicken meat could make it into the food supply? And that, it could like salmonella, where by touching it or something like that could pass a virus.
Yeah, we haven't seen that at all. And I think the difference with chicken, people eat raw beef, right? And drink raw milk. I don't know that any culture eats raw chicken. And again, cooking it will destroy the virus. So, but there's a lot we have to learn about this virus. Flu's been around for forever. And as I said, my dissertation in graduate school was on influenza. There's still a lot we don't know. It's a very tricky virus.
Thanks.
So I have a two-part question. The
Okay,
first is,
stop sharing. There we go.
okay. The first part of the question is, what vulnerable populations are most affected by H5N1? And then keeping this in mind, do you have any key considerations for messaging to these populations?
So right now, the populations that are considered to be at risk are dairy workers. And I think in one of those slides, I had a picture. I didn't know this till reading up on it. But if you work on a dairy farm, and they're mechanically, it's not like in the old days where you squeeze the udder. You are in a well, and so that your face is right at the same level with the cow's udder. And so as you're putting on and taking off the machine, you can get splashed in the eye. We think that's why these first two people had conjunctivitis. So right now, it's dairy workers who are at high risk. And again, because a number of them are not documented, there's a population that may not be seeking medical care, that it may be a little wary of dealing with government officials, even if CDC comes in and doesn't care what their status is. They may not know that. So right now I would say dairy workers. If we start to see human to human transmission, then it's like any other health condition. It's lower income, non-English speakers, all the things you all know about who is vulnerable in our society. About communication, again, the CDC, state health departments are sending out information to dairy workers about it. But part of the problem is how dairy farms work as well. We're not sure how the virus is getting spread from cow to cow, or how if it's being spread. We know it's being spread from cow to cow because we're seeing these outbreaks. What we don't know is how it's being spread. We also, so it's, I mean, you can do communication about wearing PPE, about washing your hands, but if we're not positive how it's getting spread, it becomes a little bit harder to give discrete prevention methods.